All right.
Good evening. Good evening, everyone. Welcome to our inaugural HPV Town Hall. We're so delighted to have you with us this evening and to spend time with you. We have a great lineup of speakers. They're going to speak briefly, and we will spend most of our time tonight hearing and answering your questions. Our first speaker tonight is our very own Ms. Christina Cody from the Cherokee County School District. Ms. Cody.
Thank you. And I'm here with my son, CJ. We're glad to be here and excited to kind of talk about something that's not really fun to talk about, but it's one of those things that we need to discuss a lot more because it affects so many people. HPV is the most common virus that causes a lot of cancers. And for me personally, about 18 years ago, I went to the gynecologist for a regular Pap smear. Had some questionable test results come back. Had to go back for a repeat, and unfortunately, they were precancerous cells with the presence of HPV DNA. So I had to go through a colposcopy where they go in and they remove the cells from the cervix. It was very painful. It was very scary. I think it's one of those things that if a vaccine is available that has the effectiveness that this one does, it's just so important to get that. There was not a vaccine available when I was growing up, and it's hard to think about your kiddos being sexually active when they're only 9, 10, and 11, but that's when it's most effective to get the vaccine. And if it can prevent my kids or their spouses, their future spouses from having to go through something like I did, then I think it's totally worth it. And for me, I had to go through that process twice before I had children. Luckily, I haven't had that experience in the past 14 years where I had negative results on a Pap smear. So I feel like it's one of those things that's a constant though with every annual checkup that it could still show up, and so it could lay dormant for a while and still show up. I've had friends who've it's been dormant and now they're going through procedures right now. Um, Unfortunately, I had a college friend who was actually sexually assaulted and contracted HPV. And that's one thing to consider with our kids is, it may not be by choice that something tragic happens to them, and just being able to protect them as much as possible. I think choosing to get the vaccine is important, and I'm really grateful to some of the team members that people are going to hear from today that they'll be able to bring the vaccine to our county and make it really accessible. And so, what I would suggest to people is, particularly women, of course, is to get that annual vaccine. And Cherokee County does not have we don't have the gynecological services that we used to have. So, access is a problem as well. So, I feel like if you don't have access to a gynecologist and you need to get that annual checkup, reach out to your school nurses. They know how to go. Even if you're just a parent, they know where to direct you. Our local health department, and there's some great people on here that can also share some resources with you about getting access to that care.
Thank you, Ms. Cody, so much for sharing your personal journey with HPV and with an HPV infection and the subsequent treatment. In my excitement about opening, I was remiss in stating that this is a partnership with the Cherokee County School District, the Medical University of South Carolina Hollings Cancer Center, Duke University, and am I missing anyone? So, and local providers in the Cherokee County area. So we're all excited. This is a true partnership event, and we're all excited and delighted to be here with you tonight. Next, we'll hear from young brother CJ, and he is going to share his experiences. He made a decision on his own to get vaccinated, and he is going to share with us now his decision making process. Young CJ.
So my parents, they gave me the choice to get the vaccine, and we always have open family discussions, and they always answered whatever questions I had, and I was asking questions about it, and like what all the vaccine prevents. And at the time, I was reading a book called The Immortal Life of Henrietta Lacks, and it was talking about her journey with HPV, and she later got cervical cancer from HPV, and she later died from it at a young age. And I was just reading that book, and I was thinking to myself, I mean, if it's that bad, then I need to do something to help prevent it. And I mean, if the HPV vaccine can prevent multiple different cancers, then why not? Why risk getting HPV by not taking the shot? I mean, rather than multiple procedures uh, being done to your spouse or whoever, then I mean, it's one shot compared to multiple procedures. And based off what she described, I mean, I wouldn't want anybody going through that. And it was before I was born when she was diagnosed with it. But she explained the procedures to me, like explaining how painful it was, and like how scary it is, and like how much how worried she gets every time she has to go back for another pap smear, like in case something's wrong, because it can always come back. And I would recommend getting it because, like, if you give it to your spouse, then it's just going to be painful for her and not good for your kids because, I mean, it's saving somebody's life by getting the vaccine. I mean, it's like I said earlier, one shot compared to 3 or 4 procedures.
So what would you tell people your age, that your classmates, that, you know, this van's coming to your school? What would you tell them and want their parents to know?
I mean, they might not be sexually active at the time, but most of them will be at some point in their life, and it could save somebody's life.
Let's go.
Wow, that is powerful and profound. Thank you, Brother CJ, for those words of wisdom.
Thank you.
I'll be thinking about that for a long time. I'd like to remind everyone who's watching and listening, if you have any comments, please put them in the chat and we will read your comments and answer them. So this is meant to be interactive. So please send your comments to us and we'll make sure that they get read. Thank you. Our next speaker is Dr. Jerlinda Ross with the Medical University of South Carolina. She is an expert in gynecologic oncology. Dr. Ross.
Thanks for having me, Dr. Ford. I wanted to talk briefly to connect the dots of HPV with a cancer. I predominantly focus on female-related cancers, but we'll also discuss male-related cancers in respect to HPV as well. Next slide, please. So HPV, which is better known as the human papillomavirus. Next slide, please. It's important to realize that this virus has many strands. You have 2 types. You have low-risk strands that do not cause cancer, specifically HPV type 6 and 11, and they're responsible for 90% of the genital warts that are caused. And then you have high-risk types, those that cause cancer, specifically HPV 16 and 18. So the HPV vaccine, we want to target directly these because they are associated with 63% of all HPV associated cancers and about 60%, 66% of cervical cancers. Other HPV types that can lead to cancer include 31, 33, 45, 52, and 58. However, they only make up 10% of all HPV associated cancers. Next slide, please. When we look at cancers that HPV cause, in women specifically, it can lead to cancer of the cervix, vagina, and vulva. It can lead to penile cancer in men, anal cancer in both men and women, as well as cancer of the back of the throat in both men and women. That includes the base of the tongue and tonsil, which is also known as the oral pharynx. The big issue is that we don't know who ultimately will get cancer once they are exposed to HPV. And cancer takes years, even decades to develop. So if it's anything that we can do to try to prevent it in the future, that would be ideal. Next slide, please. So when we look at the number of cancer cases caused by HPV in the United States each year, when we look at women, it's a total of about 21,100, and this is the most recent data from August 2020. And in cases in men equals about 14,800. For women, specifically, the top cancer that HPV will be associated with would be cancer of the cervix, and the next would be cancer of the anus. When we look at men, the top cases will be cancers of the back of the throat at 11,800. Next slide. So specifically talking about women and HPV, the biggest cancer we're trying to prevent would be cervical cancer. So in a year, you have 200,000 cervical precancer cases, similar to what Ms. Coley discussed. And of those, 11,000 will actually go on to develop full-blown cancer, cervical cancer. And sadly, many of those women will die from cervical cancer, and it'll cause about 4,000 deaths a year. More than 9 out of every 10 cases of cervical cancer are caused by HPV. But the good news is almost all cervical cancer can be prevented with the HPV vaccination. Next slide. It's important to remember when we talk about HPV and its effects, it's not just women. It affects men as well. And more than 4 out of every 10 cancer cases caused by HPV cancer occur in men. And as we discussed before, anywhere from 14 to 15,000 men will get cancer each year caused by HPV. Next slide. The good news is there is protection from HPV with the vaccine. HPV vaccination can prevent over 90% of cancer cases associated or caused by HPV. The good news is if you obtain the HPV vaccine, this also extends to precancer, so abnormal cells that can lead to cancer. So if you have precancer of the anus, of the vagina, cervix, or vulva, having the HPV vaccine can decrease your chances of developing a precancer, but also if you so happen to develop a precancer, it can decrease the chances of it returning. I think that's the end of my slide presentation. The one take home point I will make is I've never met a woman that regretted getting the vaccine. However, I meet many women, many of which are my age, in their 30s and even in their late 20s, they regret the decision not to get the vaccine. Specifically, I'm encountering women that had the option to get the vaccine, and they were given the option by their parents to get the vaccine. And one went to tell me, despite her mother pushing her to get the vaccine, she did not. And ultimately, she developed cervical cancer at the age of 27 with 3 children who were all young. And the one thing she would tell anyone on this call is that if she could go back in time, she would have had the inconvenience of having a set of shots that might have caused some pain in her arm, as opposed to having now stage 4 recurrent cervical cancer with young children. So that's probably the one take home point I will make. I've never met someone that regretted getting it, but I met many women that regret not having it.
Thank you so much, Dr. Ross. That is really impactful. Thank you for the information you shared. And we're really echoing young brother Cody. You know, we can get something now that can prevent a cancer in the future. And his mom has been going through just what you're describing, and just the anxiety of going for her pap smear and getting the exam, getting the test, and every time wondering, is it back? Is it back? So thank you, Dr. Ross, for sharing. We know that you work with women every day. And so we thank you, women who wish they had gotten the vaccine. Thank you. Our next speaker is Dr. James Roberts. Dr. Roberts has been with MUSC for quite some time, since 1997, and he is a professor of pediatrics at MUSC. Dr. Roberts?
Thank you, Dr. Ford. And you can go on to the next slide there, Christina. As we already heard that HPV is a virus, there's millions of people in the United States alone who have gotten this infection, about 14 million every year, and almost everybody who becomes sexually active is likely to get this virus at some point in their lifetime if they don't get the vaccine. Next slide. Simply put, the vaccine is something that will trigger or cause the body's immune system to respond to the disease. And so it's not that the vaccine itself is causing the immune response, let me rephrase that. The vaccine itself is triggering that body to respond. Next slide. So this vaccine is, as we've already heard, the HPV disease hides in the immune system. And unlike most viral infections, they may last for a few days or a week and then they're gone. This virus will stick around for years. And nobody ever knows who's going to get cancer or how it's going to eventually develop. It may be months or years after they were infected before it becomes cancer. And so the only real way to prevent this cancer is through the vaccine. There are 3 different vaccines that have been developed. The most important thing to remember or understand about them is that each vaccine is geared towards certain numbers or strains of the virus. You heard Dr. Ross mention the different strain numbers. And pick your favorite number. Any number can be used to a strain. It's not anything magical about that, but each virus is slightly different enough to cause different things in the body. Next slide. So this slide, just the easiest way to describe this is I have you put your hand over all that fancy, difficult words on the left side of the slide and just look at that photograph on the right side of your screen. And what the manufacturers did is they developed this particle that on the outside looks just like HPV disease, the virus. But on the inside of that picture, that object, there's nothing, it's hollow. So think of it as it's like a balloon. So the outside looks like the virus. When the body sees that, it triggers the same response as if it had the disease, so that the body produces defenses against the virus. But at the same time, it's not infecting anybody with anything on the inside that causes disease. So it's important to understand that when you talk about a vaccine, you're not talking about giving the disease itself to the person. It's just the outer shell. Next slide. It's a very safe vaccine. There's been thousands of people who have been tested. The first vaccine just looked at 2 different strains that caused the primary bulk of cervical cancers. 30,000 women were tested, or were in test for that. The second vaccine, which was used for many years, they call it quadrivalent because it included 2 other strains that caused genital warts. That was also tested in 29,000 people, male and female. The 9-valent, which is what we use now, adds an additional 5 strains of a virus that also causes cancer. So it's 15,000 because these studies really build on themselves from the first study. So the vaccine was first approved in 2006 for girls and then in 2009 for boys. There's been additional studies that have been done since that have looked at other safety conditions and effectiveness conditions in over 3 million people. And 135 million doses of the vaccine have been now given. Next slide, please. There's some side effects: pain, swelling, headache, allergy. You might hear about fainting. That's actually fairly common from any kind of vaccine, but it just seemed to make the press with this particular vaccine. But there's no long-term danger from that side effect. Next slide. It's also very effective. 4 years after the first vaccine was released, significant decrease, 56% of decrease in infections. 12 years later, 88% of decrease in infections, and more than half of the people who have 50% lower cases of cancer or precancerous lesions have been found now. And next slide. The last thing I want to leave you with is just what we use in our pediatric clinic for schedules of teenagers' vaccines. And it's bundled together with the tetanus vaccine and the meningococcal vaccine. But we start the doses at 9 years of age, actually. The CDC recommends at least 11, but the FDA has approved it down to 9 years of age. And it's actually really good to start earlier because I see kids all the time for their 11-year-old well visit. They come in because there's a required vaccine. Prior to that, if we start the series at 9 or 10, when they come in for their 11-year-old vaccine, they're going to be brought up to date as opposed to worrying about trying to get them in for that second shot visit. I think that's all I've got. I think that what I really like to say is that the HPV vaccine really does save lives, and it's so important to recommend it. Thank you.
Dr. Roberts, thank you for that message. The HPV vaccine saves lives, and it's so important to recommend it. Thank you. We know that you work with children in your clinic, in your practice, every day. And as they develop into adulthood, hopefully they'll thank you one day for the work that you're doing with them.
Hopefully, and they'll thank CJ too.
Yes, CJ is definitely our ambassador. Absolutely. Thank you. Next, we have a chance to hear from someone who is not from the Medical University of South Carolina, but is from Duke University. We have with us Dr. Sayward Harrison from Duke University. She's been working with the Cherokee County School District on a project that maybe she'll talk a little bit about. So welcome, Dr. Harrison.
Great, thank you so much. And just a slight correction. So I'm from the University of South Carolina, but work in close partnership with colleagues at Duke University and with our amazing partners in Cherokee County. So I'll talk a little bit about that project now. Thanks so much. So as Dr. Ford said, my name is Dr. Sayward Harrison. I'm a pediatric psychologist and an assistant professor in the Department of Psychology at the University of South Carolina. So in my role at USC, I run a research lab called the Healthy Futures Lab, where our goal is to contribute to building healthier kids, healthier families, and healthier communities across South Carolina. As a social and behavioral scientist, my research really focuses on how we can improve prevention and treatment systems for infectious diseases, or those diseases that spread from person to person. Over the past several years, one area that I've become very passionate about is how we can partner together in communities to get more adolescents vaccinated against human papillomavirus, or HPV. As you've been hearing tonight, HPV is an extremely common virus. I've had it. If you're an adult who's listening to this, you have probably had it too, whether you're aware of it or not. Almost all adults in the United States will come into contact with HPV at some point in their life. So as you've already heard, some types of HPV are low risk, but other types of HPV are high risk, and they cause serious cancers for men and women alike. In fact, as we've heard tonight, most cases of cervical cancer are caused by HPV, and HPV also causes cancers in the head, the neck, the throat, penile cancer, anal cancer, vaginal cancers. But the great news is that those cancers can be prevented through HPV vaccination. HPV vaccine is recommended for all kids, as we just heard, starting as early as age 9. And with 2 quick shots for our young kids, we can dramatically lower the risk of future cancers for them. So I care about HPV vaccination, not only because I'm a researcher and a pediatric psychologist, but also because I'm a mom. I have a 13-year-old daughter named Beatrice, who is my whole world. When I found out that there was a shot that could protect Beatrice from cancer across her lifespan, I just felt so grateful that I could do something as her mom that can help keep her healthy, not just right now, but for the rest of her life. I talked with her pediatrician, and he said, what the data show to be true, that HPV vaccination is safe, it's effective, and it's cancer prevention for our children. So while my daughter Beatrice is now fully vaccinated against HPV, unfortunately, many other kids her age are not. We're making a lot of progress in getting more kids vaccinated against HPV and preventing those future cancers, but we still have a ways to go. And one of the big gaps that we know about is in our rural communities, like many of the communities in Cherokee County. So kids in rural counties in the South are much less likely to be vaccinated against HPV than kids who live in larger cities. And that's a real concern, because we know that where we see low rates of HPV vaccination today, in 20 and 30 years, we'll see higher rates of HPV-caused cancers in those same communities. So we need to work together to figure out how we can reach high levels of HPV vaccination so that we can protect our own communities from cancer in the future. For the past 3 years, I've been so fortunate to work closely with community members across South Carolina and right here in Cherokee County on a project called INVEST. And the goal of the INVEST project is to increase HPV vaccination rates in rural areas in North Carolina and South Carolina. We have a great team of people from medicine, public health, health psychology, from Duke University and USC. And we've been working to better understand the challenges and concerns around vaccination in our rural communities. We've listened to parents and school nurses and local healthcare providers about what we can do to get more of our kids vaccinated and protected from HPV and other infectious diseases. And as a result, this past year, we've been excited to roll out the INVEST program in Cherokee County, especially with the help of our partner and school nurses. So this year, for you parents who are listening, you've hopefully seen some of our INVEST materials. We've been sending home newsletters, handouts, flyers. We have a social media campaign going within Cherokee County. We've been sending information on where you can go to get the HPV vaccine for your child in your community. And we've especially been working so closely with our school nurse partners who are there to provide you with evidence-based answers to your questions about vaccination and any other health issues that your child and your family may encounter. And I'd just like to wrap up by just personally saying thank you so much to our amazing school nurses who have really been heroes. They're heroes all the time, but they've especially been heroes during the COVID-19 pandemic. They have been working so tirelessly to connect families to resources, answer questions, and keep our schools and our communities healthy. Our school nurses understand that getting our kids vaccinated with safe and effective vaccines is a key part of keeping our community healthy. And I'm so grateful for their collaboration and their support, especially around increasing access to and uptake of HPV vaccination. So thanks again to all of our partners, and thanks to you parents, who have been on the receiving end of our INVEST project. We're here for you and ready and excited to answer questions you may have.
Thank you so much, Dr. Harrison. That was amazing. Thank you for that wonderful information. And I'd like to share also that the MUSC Hollings Cancer Center is bringing our HPV vaccination van to the Cherokee County School District. So on March 7th, we'll be at Gaffney Middle School from 8:30 a.m. to 2 p.m. On March 8th, we'll be at Ewing Middle School from 8:30 a.m. to 10:30 a.m. And on March 8th, we'll be at Blacksburg Middle School from 12:30 p.m. to 2:30 p.m. And as Dr. Harrison said, we are just indebted to all of the school nurses and the whole team in the Cherokee County School District. We are really appreciative. We thank you. We're all in this together. This is a team effort, and we're all working together to solve the problem of people dying from these HPV-related cancers, males and females. So thank you so much, Dr. Harrison. I believe now we'll go to Q&A. So let's go to questions and answers. And if anyone has a question for any of the speakers, please put them in the chat And now is the chance, if you have a question for Miss Cody, I saw she got a shout out, that's my teach, from a Facebook user, and a shout out to Fit Together as well. If you have a question for young brother CJ, please type your question in. If you have a question for Dr. Jerlinda Ross, please send it to us, or Dr. Roberts, or Dr. Harrison. So this is the time you can, text your questions. You can see the number there to 864-649-0012, and we're happy to take them. So I see that we have one comment. The comment is, the absence of symptoms does not exclude the presence of an inflammatory phenomenon, with epipharyngitis being found in all women examined after HPV vaccination in Japan. So I think that's a question maybe for Dr. Roberts or Dr. Ross, or one of our school nurses.
I think I would say that when you look at the data over the years following the vaccination, we're not seeing significant amounts of anything to suggest adverse events like that.
Thank you.
And I think one thing I'd also comment on is it's really really a challenge for us here in the U.S. We've got so much work to do to increase HPV vaccination, but some other countries are really leading the way. So, for instance, in Australia, they have now have almost all of their adolescents vaccinated against HPV, and they have seen dramatic decreases already in cervical cancer screenings and cervical cancer rates, so much so that they've already been able to change the recommendations for how often women need to go to the OBGYN and get cervical cancer screenings done, because cervical cancer is just dropping as we've seen them be able to achieve that high level of vaccination. So we know from data in Australia that they're really on a trajectory to eliminate cervical cancer, whereas women in the United States will still be dying from cervical cancer. So I just always think about that this is really a health equity issue. We want to make sure that we don't have people unnecessarily dying of cancer here in the US when other countries around the world have been able to eliminate these HPV-caused cancers.
Thank you so much, Dr. Harrison, for reminding us that, we can actually prevent deaths through the vaccine. And we heard that from many of our speakers. Thank you so much. One question that we sometimes get from parents is, what are the long-term effects of the vaccinations? Like, what happens 20 years later after the child is vaccinated?
20 years later after they're vaccinated, they don't have cervical cancer. I think, again, that same point that Dr. Sayward just made, sorry, Dr. Harrison, that she just made is that, we have long-term data, 135 million people have been vaccinated, and all the adverse effects are really self-limiting. And we know from other countries that have been vaccinated even longer than we are. We're 20 years into this almost, and other countries even longer. And it is a very safe vaccine.
Thank you. Have you seen any differences by race or ethnicity in how well the vaccine works?
That may be for Dr. Ross. I'm not sure. I find that in all teenagers, the younger you are, the better the immune response is.
Me personally, just from at least the literature that we have from a cancer standpoint, and it's very limited, and some of it more than likely is going to come from other countries where you have a significant uptake of the vaccine, but I have not seen that.
Thank you. So I guess the message is the vaccine works well for everyone. Great. What is the dosing? Can you review that again?
I'm sorry, as far as the interval?
Yes, the intervals. Thank you.
Okay. So for anyone who's 14 or younger, you get 2 doses 6 months apart. If you start the series at 15 or older, then it's a 3-dose series. And so a lot of times, as long as you start that first dose at say age 13 or 14, and even if it's 5 years later, they still need just the one more dose. And that was a change several years ago when CDC and others realized that the younger you are, the far better the immune response that you get.
Yeah, and if I can add something as well, because there may be parents who are saying, wow, I'd never heard about this vaccine when I was a child. Is this something that I should consider for myself too? And I would say we want all adolescents to get vaccinated, complete that series when they're still ages 11, 12. As we just heard, if you start after 15, then you're going to need 3 doses. But even as we think about older people who may not have been able or had access to the vaccine when they were younger, what we call catch-up vaccination is available through age 26. And then for people who are ages 27 to 45, so that may fall into some of our parents who are listening into your age ranges, people who are 27 to 45 years old should talk with their doctor about whether there may be benefits for them to get the HPV vaccine if they were not able to get it as a child.
And thank you so much, because one of our questions was, can you be too old to get the vaccine? So that's a great response. Thank you. I was wondering.
Can I add one more thing from the dosing standpoint? One of the things that came up when we went to the 9-valent vaccine is that people would maybe get the series with the 4-valent vaccine, and they would ask, well, if I got the 4-valent already, do I have to restart the series? And the answer to that is no. So even if you started with the 4-valent, you still can complete the series with the 9-valent. It's a little bit less of a moot point now because we've been using the 9-valent for a number of years, but just want to make sure that people knew that.
Thank you. That's so important. And nurse, yes.
I wanted to add one thing, just to keep in mind for the moms that are on the call. If you were diagnosed with some form of pre-invasive or pre-cancer of the cervix, there's new studies that have shown that if you've been treated with for that precancer, whether or not it's a colposcopy and you had biopsies, or if you had some piece of the cervix that might have been frozen with cryo or cut out, the studies would show that if you get the vaccine, you can decrease your chances of this coming back to bother you again. And so that can give you that peace of mind when you go to the doctor to have your follow-up pap smear, that you've done everything that you can to try to make sure that you don't go on to have an HPV-related cancer of the cervix, at least.
Thank you so much. So it sounds like we're saying that we have multiple audiences here for the HPV vaccine. We have the students and we have the parents who could also get vaccinated. So thank you. This is really great. Nurse Barrington, what are some of the common things that people have said to you in relation to the vaccine?
I run into often some kids who, like I think it was Cody mentioned, may just not want to get another shot. They're already getting a couple of ones, getting up to date on everything, and so often we hear that kids don't want another one. But I think keeping in mind the end game, right, or the long term things that you want, outcomes that you want, and things that you want to avoid as well. So I think, fear of getting another shot or anxiety is a big issue that we see every day in clinic.
And how do you address that? Anyone?
Well, we just try to talk through and, let people know that we always have it available if they're not ready for it for whatever reason that day. It's something that, it's not that's not their final decision, or doesn't have to be their final decision. You can always, call us anytime. We're happy to get you in anytime. If you change your mind or have other questions or anything, we always encourage the vaccines, but we're happy anytime to review that information with you.
Thank you so much. I just wanted to point out, I had mentioned that our HPV Vax Van is coming to the schools. Not only are we giving the HPV vaccine, but we're also giving the Tdap vaccine as well. So just wanted to make you aware of that.
And I believe the MCV vaccine too, the meningococcal. So all three of the primary teenager vaccines will have.
Thank you so much. So that leads to the next question, which is cost. So some people may be wondering, if my child is less than 18 years old, how much does all this cost?
So I can comment at least from a vaccine for children standpoint, which is a federal program that provides the vaccine basically for free in anyone who's underinsured or uninsured. So that would include no insurance at all, Medicaid insurance, or other insurances that may require a significant copayment. All of them may qualify or should qualify under the Vaccine for Children program. And then in a lot of cases, a lot of the private insurances do cover the approved, in this case is an FDA approved vaccine. So all of those are also covered by their insurances.
Thank you so much. So
and there's a note in the chat too that for that federal program on the DHEC website, if there's any question, they can also look there for information about signing up for any federal programs.
Thank you so much. We have another question here that says, you may have already answered this, but will this HPV vaccine provide any reduction in the possibility of getting breast cancer?
Unfortunately, that's not the case. Breast cancer has not been shown to be related to HPV. So the primary modality that you would need to use for prevention would be mammography or some form of breast cancer screening with your physician.
Thank you, Dr. Ross. And Ms. Cody, are you getting questions as well that you would like to read? Or?
None on the text line yet.
Okay.
Now, I'd like to share, and the doctors on here can kind of correct me if I'm wrong, but you look at the history of infant AIDS in our country and how we've been able to really eradicate that if we know that a mother that's HIV positive is in a facility having a child, and we can prevent that child from contracting HIV. I see the same thing is possible with cervical cancer in our country if we can get people vaccinated and really, really diminish those numbers. It's such a painful and harsh treatment cancer. Watching a classmate kind of tell her story, and she passed away in the last year, and she's 43 years old. So just seeing the journey and everything she went through, and I know we have some proponents on Facebook. Miss Wiley shares her story that she's going through currently with HPV and that. And I feel like if we can just be a little more open and reducing the stigma associated with HPV and a lot of other things, I feel like everybody will just be better off. So sorry, I just want to throw that in there.
That is so important. And maybe we can spend a few minutes talking about the stigma. I know we have a pediatric psychologist with us today, Dr. Harrison. So maybe if you could maybe talk a few minutes about the stigma.
Yeah, absolutely. I think that, everyone is so right. Like the stigma is really what's holding us back. And I think that some of that just stems from a lack of understanding and a lack of knowledge. I think if people really understood that almost every adult is going to acquire HPV, it's a very common viral infection. It's not something to be ashamed of. And we have tools that can, prevent those high-risk types of HPV entirely, and then prevent you from ever having the risk for one of those cancers that we've talked about. So I think that the stigma is something, by having people share their experiences, by having us understand, again, just the prevalence, how common this is, that it's not something we should be embarrassed to talk about. And then I think too, I have training in public health, and it was many years before I made the connection that when I'm going to my OBGYN visit, when I'm getting a pap smear done, that they're looking for changes caused by HPV. I think that sometimes we just have not done a good enough job educating women, educating parents, educating kids themselves about their body and about the different prevention tools that we have.
Oh, that's so powerful. Yes. We don't educate ourselves and our communities enough about our bodies and the prevention tools. And the vaccine is a prevention tool. It's a cancer prevention tool. And we often hear the statement, wow, if there was a vaccine that could prevent breast cancer, wouldn't it be great? I mean, I've had breast cancer twice. I can assure you, if there was a vaccine that could prevent it, I would have been the first one lined up for it. Nobody wants to, thank God we have good treatments today, but nobody wants to hear the words, you've got cancer, right? So to have a vaccine that prevents cancer is so exciting. And we're just really thrilled to have all of you here tonight. I did want to ask you a question about whether any of our clinicians have heard a question about, I guess, anything about religious concerns, or have you heard anything along those lines?
Well, I can say that I have heard some concerns that these vaccines are against their religion. I try to, find out a little bit more about their concerns or their beliefs, but I usually don't get any response back other than, well, it's just against my religion, and it's sort of, I think, a way of stopping the conversation. They don't want to continue it. But I think that, when I think of against their religion, I think of usually with Jehovah's Witness and blood transfusions is the one that comes up the most commonly. But I think deep down inside, there's probably some other belief that really is important to them. And sometimes it's in their community. It may be a discussion among their church group in their community, and there's concerns. And I think if we find some people who are open to talking more about it, I think that's something that we could talk through.
Thank you. And anyone else?
Yeah, I would just chime in that there are not any major religions in the United States that expressly prohibit vaccinations or discourage vaccinations. And again, I like the comparison to breast cancer. Like we want our families to be healthy, to live, not to die from preventable illnesses. And I think, in my faith, that's something that I can't see anything that's in like contrast. We want to be healthy. We want, again, to be able to use these amazing tools that science has given us and medicine has given us as a way to keep ourselves healthy and protect those who we love. So I think it's a great decision. And I think that if people do have questions, then talk to your provider and hear from them about, again, the evidence that we have that these are safe, that these are effective, and that these prevent cancer.
Dr. Ford, we have a text question.
Thank you.
If your child has had COVID, how long do they need to wait to get the HPV vaccine?
That's a great question. And this is one thing that has not been studied as well, because the COVID vaccine, as you know, is so recent, as well as the COVID illness. And so the short answer to that is that we don't have a time frame on vaccinating versus not vaccinating. So if they have a COVID illness, then we simply wait until they're feeling well enough to come back in for vaccine or a vaccine visit. Their body will still respond to the vaccine. Generally, I think from a practical standpoint, you'd probably want to wait 10 to 14 days after they're testing positive and ill, just to make sure they're feeling better and able to respond. But I always thought that part of that question was going to go the other direction, which is, if I want to give my child the COVID vaccine, can I also give them the HPV vaccine at the same time? And the answer to that would be that we do that. Again, the COVID vaccine is so new, we've not actually done trials looking at how well each of the vaccines respond when given together. But because they're both very different and you're stimulating different parts of the immune system, we do vaccinate all of them together with the flu vaccine, the COVID vaccine, and the HPV vaccine. I did want to, if I could, I wanted to go back to another comment that Christina brought up about eliminating cervical cancer with vaccines. And I just want to bring up a historical vaccine, which we still give on a regular basis, which is the polio vaccine. In the 1940s, families were just terrified to let their children play in the swimming pool in the summer out of fear of contracting polio. The polio vaccine has been so effective that it's virtually, except in some countries, completely eliminated from the earth. And measles has had some of the same benefits as long as people still give their children the measles vaccine. When they stop vaccinating, measles has come back, and it has come back in numerous places. For cervical cancer, and Dr. Ross can correct me if there's something I misspoke here, but for cervical cancer, about 81% of cases of cervical cancer are due to one of the 7 strains within the 9-valent vaccine that causes cervical cancer. So we can go a long way in eliminating, or at least substantially reducing, the number of cases of HPV-induced cervical cancer by vaccinating.
Thank you. Dr. Ross, did you want to add anything?
I agree. I agree with that. I think the biggest thing is even going back to the religious belief, because oftentimes I even hear that when it comes down to even being treated or moving forward with certain types of treatments for cancer, when you dig a little bit deeper into what the beliefs are, what you discover is very little of it have to do with the vaccine itself and what it's preventing. It's rooted in something else. And so when you can get to that root cause, and sometimes it actually just takes a listening ear to hear, and then just some education to help them understand that we're not, or this vaccine does not necessarily interfere with that particular belief that you have, and this is what the vaccine is for. So just education sometimes can be helpful, just to try to make sure we can try to leave the door open, because once someone shuts the door on hearing about the vaccine, ultimately they shut the door, and then they shut the door to everyone else around them. And so you have a lot of misinformation that can be spread, and that'll go on to their family as well as their friends. So that's just something to keep in mind as well.
Thank you so much. We appreciate all of the providers who are here tonight, who spend so much time with your patients, listening and answering questions. And that's so important. And I think that when people see that we really care and we really do want to understand and to respond, I think that makes a big difference. So we appreciate everyone, each of you. I did want to make sure that everyone has had a chance to speak who would like to speak tonight. Not to put anybody on the spot, but what I think that if everyone can just look at this group assembled here and think about all the people who are participating tonight, this is a really important issue. Everyone's here tonight because of the seriousness of the need to increase the rates of HPV vaccination in our state. We really just have too many people dying unnecessarily, and we have a tool. Someone mentioned a tool that can prevent it. So hopefully everyone can see how important the issue is, and you have a whole team of people who really care for you and care about you. And we'll be able to answer any questions, whatever questions you have. When we come with our HPV Vax van, we will take the questions back to our experts, Dr. Ross, Dr. Roberts, Dr. Harrison, Ms. Barrington and others, Ms. Cody, Miss Beatty, Nurse Becky, and others, and we'll make sure that your questions are answered. So we'll make sure that we get back to you with any answers to questions that you may have. We're here for you, we're listening, and we are really excited about coming out on March 7th and 8th and getting a chance to meet some of you as we give the vaccine. I think we'll turn things back over to Ms. Cody and to Brother CJ at this point. I call him Young Brother CJ. Okay.
Thank you, Dr. Ford. Thank you for moderating this too. And we actually had one more question come up in the comments. Will getting the HPV vaccine make me more susceptible to contracting COVID, reducing the immune system after receiving it?
I'll go ahead and answer that one from my perspective, and the answer would be no. What if anything, what happens when you get your vaccination? It stimulates your immune system, so your immune system is actually revved up and responding. And so, if you were to be exposed to COVID, your immune system is actually already starting to respond. And before we had the COVID vaccines fully developed, there was already some data that were coming back that were saying that those who had already gotten, say, flu vaccines and other vaccines were already showing some possible susceptibility or I should say protection from getting severe cases of COVID. And so anything that stimulates the immune system is actually good in many ways, but especially in having your body revved up and ready to respond to any other infections.
Thank you so much. Thank you to everyone who sent questions. Thank you to everyone who's here tonight. To our great panel of experts, we appreciate you. And to everyone who helped to put this great evening together. And now I really will turn it over to Miss Cody. Thank you.
Well, just mirroring what Dr. Ford said, we appreciate everybody that tuned in live, and we will have this video recorded. It's been recorded, so we'll be able to post to social media. You can see it later. We'll break it down into segments, associated with certain questions, so that you don't have to sit and watch an entire hour if you don't have an hour. But you can always come back to it. And I appreciate all of you and the commitment of Nurse Mary, Beatty, and our school nurses that were able to join us today, and our providers, and everybody that was just really instrumental in putting this together, this educational piece, so that parents can make the best decisions for their kids. And hopefully we had a few students tune in too, and be able to learn a little bit from this. So I appreciate everybody, and I'm happy to be here. And I'm a science teacher, and those open conversations in your household are very important, because if you're not answering your kids' questions, they're going to ask their friends, and they're going to ask the internet. So if you need help on how to talk to your kid about sex or all of the things that are associated with that, I'm more than happy to help. I am a school district employee, so I'm right here at your service. So you can reach me, I think, through any of these platforms. I'll be happy to have those conversations with you, because it's so important that kids get the right information. So anything else? All right. Well, I guess we will call it a night. Thank you all so much. And we look forward to the mobile vaccines.
Thank you, everyone.
Thank you.
Have a good
Thanks,
night.
everyone.
Yeah.
Good night.
Good night.